Thank you for joining us here today. Western Australia is seeing increasing COVID numbers on a daily basis now, mainly driven by arrivals from interstate and overseas. This is no cause for panic. It's what we have been predicting as we adjusted our border controls. And it reinforces why we delayed the full opening of our hard border, based on high transmission rate of Omicron and our third dose vaccination rate. Although our border adjustments struck a balance that enabled thousands of Western Australians to return home safely. Overnight, Western Australia has recorded 139 new Omicron cases. 37 of those are local cases, which is the highest number of local cases WA has recorded over the last 2 years. 29 of those 37 are linked close contacts. 8 are currently being investigated. 102 cases are recent arrivals from interstate or overseas. We have 1 person in hospital on a ward. WA Health will continue to monitor and advise a residential aged care facility in Bentley after a resident and a staff member tested positive to COVID-19. In total, 7,567 people were tested at PCR clinics yesterday. This does not include the many RAT tests that are now being conducted at home. I will add that of the 139 new cases, this includes 7 positive results from rapid antigen tests, which were registered on our online system. Yesterday, we announced the rollout of rapid antigen tests for arrivals at Perth Airport to coincide with the changes to border quarantine requirements. Our vaccination rate continues to power on, with 28,046 doses provided yesterday. 98.3% of the 12 plus population have now had at least 1 dose. Second dose for 12 plus population is currently at 94%. Our third dose rate is now at 48% for 16 plus people. Our third dose is heading in the right direction, but is not yet where we need it to be. So please book in. Our 2-week vaccination blitz is currently underway, which has opened up an extra 40,000 bookings. So it's easier than ever to get your third dose, or for parents to book in their children. As I said, each day Western Australia is seeing an increase in the number of new cases of Omicron. It's a game changer that's caused chaos on the east coast of Australia and across the world. I've been clear that Omicron is not Delta, which we could crush and kill. Our recently announced high caseload protocols are about managing the spread and trying to minimise disruption. It is worth noting that currently the bulk of new Omicron cases are from interstate and overseas arrivals. That is why, based on health advice, we made the decision to update our safe transition plan, which struck a balance between community safety and compassion, which enabled Western Australians to safely return home, subject to quarantining and testing. As I've said, allowing thousands of arrivals into Western Australia with no testing or quarantine measures to seed the virus rapidly across our state would have been reckless and irresponsible. With the rapid spike in cases among returning Western Australians in the last few days, one could only imagine the kind of seeding event that could have taken place under the original plan with far higher arrival numbers and no quarantine protocols. The decision to delay the full border opening was the right thing to do for the safety of the people of this state. It was about saving lives, saving jobs, and saving our economy. And while the hard border is being reviewed this month, as we said we would, making the difficult decision to delay the full border opening has affected some industries that are based on travel. That is why I'm announcing a comprehensive multi-million-dollar package to help those industries most impacted by the border decision. Our Safe Transition Industry Support Package I'm announcing today is worth $77 million. It's a shot in the arm for businesses and organisations in international education, tourism, aviation, and the events sectors, some of whom are doing it tough. 9 targeted programs which are designed to support cash flow and help offset some of the additional costs or lost revenues in these sectors. I'll now provide a detailed breakdown of how the $77 million package will help. Firstly, international education. This is a sector that has faced significant challenges over the past 2 years due to the required state and federal border controls. International education will benefit from 3 support programs. $6 million will go to an industry support program which will provide grants of $50,000 or $100,000 to assist small and medium-sized education providers impacted by the closure of international borders. A student quarantine support program totalling $8 million will help international students with quarantine-related costs for those arriving for September 1. And $2 million to help universities deliver support services for affected international students. While the adjusted hard border settings are allowing thousands of returning Western Australians to come home over the coming weeks, the reality is the adjusted settings do not currently allow for holidaymakers to enter WA. While much of the WA tourism sector has done extraordinarily well over the past 2 years, as Western Australians wandered out yonder in record numbers, we recognise that some businesses made plans and took back bookings based on the original plan for February 5. As such, we intend to support those businesses due to the financial hit that they have taken. There will be the $20 million tourism support program to provide immediate assistance of $10,000 to sole traders and $20,000 to employing businesses to offset expenses incurred in preparation for the initially scheduled full border opening. The $15 million tourism deposit fund refund program to provide immediate assistance of up to $50,000 to eligible tourism businesses that have refunded deposits from some cancelled interstate and international bookings. A $10 million boost to the existing aviation recovery fund as part of our Reconnect WA package, taking the total in this fund to $75 million. This is all about making sure we can secure flights into WA when the time is right, and a $3 million travel agent support fund, offering grants of up to $10,000 for eligible home-based businesses and $20,000 grants to eligible brick and mortar businesses. The other key sector affected by the decision to review the border changes has been the events sector. Whether promoters, organisers or suppliers, undoubtedly some have taken a hit. As such, my government will deliver a $10 million extension and expansion of the Getting the Show Back on the Road program to cover up to 75% of lost ticket sales where a state government mandate directly requires an event to be cancelled, self-cancelled events linked to the border delay decision, and if eligible, substantially scaled back events that proceed, plus a new $3 million events suppliers support program providing payments to eligible event suppliers for ticketed events with $10,000 grants for sole traders, $20,000 for small businesses and $50,000 for large businesses with pre-COVID annual turnover of more than $1 million. As always with COVID, this funding will provide much needed support, but it will not cover everything. While it is generous, I'm sure some will say it doesn't go far enough. And the reality is, I'm sure all of these hard-working businesses would prefer to be able to trade without the uncertainty that comes from the pandemic rather than take a handout. But unfortunately, with the successful strategy to tackle the pandemic with borders both at a state and federal level, that has seen Western Australia's economy thrive like never before overall. These specific industries have felt the brunt. As greater spread of the Omicron variant occurs, we expect to deliver further measures to support Western Australian businesses and will continue to listen and respond. By any reasonable measure, Western Australia has done extraordinarily well throughout the pandemic on health, social and economic grounds, but it has not been without cost. There are no cost-free decisions when it comes to the pandemic. A decision to take the burden off one area can sometimes impact others. Everyone wants to move forward, but it is essential that we do this safely. Jobs and lives are lost if we don't. Thankfully, due to our careful and cautious approach, we've retained the financial capacity to support specific industries as and when required. Are there any questions?
With the support package, if you just opened the borders, you wouldn't have to hand out $77 million taxpayers' money. So why don't you just open the borders?
We announced this a few weeks ago, and it's because lots of people would die and there would be dire economic consequences overall. So that's why we didn't do it. And as you know, with the Omicron strain, we have the figures from over east, and I'll explain them to you. With the Omicron strain, since the start of this year, 2,190 people have died from it. None of those people have been in Western Australia. Since Queensland opened, there's been 340 people die. In hospital today, there are 3,040 people with Omicron over east. The year-to-date average hospital admissions in the eastern states is 4,137. There has been, in total cases around Australia since the pandemic began, 2,443,308, of which 891 have been Western Australian. This year. So 891 have been Western Australian. So, look, the reason we took the decision was to save lives and save jobs, but obviously there's specific industries that have been impacted, particularly travel agents, some tourism businesses and international education. That's why we're putting in place a package to assist those businesses.
The number of tests yesterday is down on previous days. Are you concerned that that's a result of the health department not updating its list of exposure sites, sometimes for days at a time?
Look, why people get tested and don't get tested is hard to determine. We are encouraging people each and every day to get tested. But over time, the list of exposure sites is going to go down because we're removing the requirement for casual contacts. As you know, you've all been calling for that for weeks. So we removed that requirement based upon health advice. And in terms of your close contacts, obviously anyone who, close contact locations, my understanding is we currently provide that information.
So exposure sites are pretty much irrelevant now. I mean, if they're not being posted for a week later and we're getting rid of casual contacts, are they irrelevant? I mean, a lot of people aren't necessarily checking daily now as it is. Have we got to the point where we just go exposure sites?
No, they're not irrelevant, but obviously you reduce the number of exposure sites because we've changed the close contact rules. So we removed the casual contact requirements, which obviously had some disruption attached to them as our case numbers grew. I explained all the reasons for that earlier this week.
Just
some
on
criticisms
the
of
funding, the new funding announcement, the $185 million for Reconnect WA, that's all there for when the border reopens, still none of that changes? This is all on top of that.
One bit that builds on one of the initiatives in there is the Aviation Support Fund. So the Aviation Support Fund now goes to $75 million. That will kick in once we fully reopen borders, and that will help us attract airlines and flights into Western Australia, particularly international tourists. So one of the upsides, I suppose, of not having COVID in Western Australia over the last 2 years is that a lot of our industries have been able to be very successful. That's delivered revenue to the state, it's delivered revenue to the Commonwealth. It means our financial position as a state is better than any other state by a long, long way. I think Victoria announced a deficit, 1 year deficit of $17 billion. New South Wales is roughly similar. We have a surplus of $5.8 billion. So that means that we're able to invest in these sorts of initiatives, and we'll do more in the future to make sure that those industries that were specifically impacted by international and interstate borders get support to recover quickly.
Can you give those providers any hope of when they'll get tourists back, interstate or international? The rest of the country's opening up to international tourists in less than 2 weeks.
Oh, well, obviously we're reviewing the situation over February, and we'll be able to provide more advice when we finalise the dates on those sorts of things, but we can't do that at this point in time. But I'll just make the point, Lots of tourism operators over the course of the last 2 years have done better than ever before because West Australians have holidayed at home. They haven't spent their money on holidays in Bali and Europe. They've spent their money on holidays in Western Australia. So you go to regional WA, it's been very difficult to get a booking. Rottnest Island, lots of tourism operators, hospitality operators, pubs, you name it around the state, have done as well as or better than ever before. I experienced it myself over Christmas when I drove to Exmouth. Went to businesses that said the last 2 years have been the strongest they've ever experienced. But there are some operators, particularly in niche areas and international education, that have suffered. So that's why we're trying to provide them with support, which we're announcing today, but we'll do more for them in the future.
The decision to allow AFL teams to visit WA under sort of a modified visiting arrangement has angered other people in Victoria particularly, who want to come to WA. Do you understand their concerns? I mean, it's natural that they would be worried that the footballers seem to be getting a free kick, no pun intended.
We have put in place arrangements for sports over the course of the last 2 years that require rigorous quarantine and testing requirements. That hasn't been unusual, and we did that for the grand final. And the arrangements we put in place in conjunction with the codes have been very safe. So that's why we've done this. It's just a continuation of what we've done over the course of the last 2 years.
Don't you think it's double standards though, that West Australians returning home have to do 7 days, yet AFLW players can just come in, play some football, and then go back?
Look,
Why is it football that gets special rules?
Well, it's the same for basketball, rugby, soccer, other sports. We've done it over the course of the last 2 years to allow the sporting codes to continue, but it does have a rigorous quarantine and testing arrangement that goes with it.
Why are the Wildcats, Glory and League still waiting on their approval when the AFLW's already got the stamp of approval?
There's a team of people who work on this with the sporting codes, and they work through the issues. Sometimes there's specific issues. They've worked through it. It's proven to be very safe over the course of the last 2 years. We haven't had any outbreaks out of it. And indeed, last year we held the AFL Grand Final very safely here in Perth. But there's people who work on it, and they'll no doubt work through the issues with those codes.
On the aged care cases, how concerning is that? Do you know if all residents have had the opportunity to have a third dose, and how do we avoid what's happened in the other states?
It is very concerning. Lots of people have died in the eastern states from COVID in aged care. Lots and lots of people. So we need to get the third dose rate up in our aged care facilities. So I'm going to raise that at National Cabinet shortly. The meeting's on later on today. There needs to be a real push on aged care. Now, it is actually a Commonwealth responsibility. The Commonwealth has responsibility for aged care facilities and the vaccine program in those aged care facilities. So I'll raise it with them. I'm going to offer all the support we can, all the in-reach we can to assist them, but they really need to push getting aged care vaccination rates up.
Is that a failing of the federal government, as the Australian Workers Union suggested today?
Who suggested that?
Karen Smith from the AWU.
Yeah. Look, obviously it needs to be better. It needs to be better. And if it gets to a higher level, we'll save lives. As I outlined to you before, we're nearly at 99% first dose across Western Australia. That's world record territory in terms of vaccination rates. But there's some areas that aren't strong, and one of those is aged care, and so it needs more effort. The Commonwealth, if they need our help, we're prepared to provide it, because we need to get more vaccinations into the people in aged care as soon as we possibly can.
Surely the state government could have stepped in earlier if you're saying not everyone in aged care has had the opportunity to get a third dose. With the extra time we've had with the border staying closed, couldn't the state government step in earlier? As
I said, it is a Commonwealth responsibility. We have offered throughout the course of the last 2 years to assist with all these things. We'll continue to offer, but I think now that we've had a case of an aged care resident, obviously it needs further effort, and we'll help the Commonwealth wherever they want us to, but they really need to put the foot on the pedal when it comes to aged care vaccination.
Has the Commonwealth provided any data to WA on the booster rate in aged care homes in this state?
I'd need to check exactly what it is, but I know it is below the state average. Significantly below, I think. So the workforce is very high, as you'd understand, because we mandated the workforce. And as I said, the vaccination rate in Western Australia, I want to read it out to you again because As you know, over the course of the last year or so, there's been lots of criticism coming out of the eastern states about Western Australia's vaccination rate. Our 12 plus, and bear in mind we do 12 plus, not 16 plus, so our 12 plus is 98.3% first dose. So our 16 plus is up around 99%. Our second dose for 12 plus is currently at 94%, and our third dose has climbed to 48% for 16 plus, which is the eligible population. So it's powering ahead at about 2% a day. So our third dose is, I think, going to be near the top of the table when it comes to the Australian states shortly. So, but the aged care rate, I'm advised, is significantly below that. That's why the Commonwealth needs to put more effort in, and we're prepared to support them.
Do you have any further information on that attack on your office the other day?
Yes. So what happened was a letter was sent, well, a number of letters have been sent, but the latest one was a letter was sent addressed to my wife. It had white powder in it. What they were intending was my wife would open it, and it contained a number of threats to harm her and my children and worse. So whoever did this is a coward of the highest order, and I just say to anyone out there who has any information about this, please provide that information to Crime Stoppers.
Have forensics got any further with determining what the substance was?
Yes, it wasn't, I understand it wasn't a harmful substance, but that's what these people do. They put white powder in on the basis that you then have to get it all tested because you never know if it's going to be something toxic or worse. So, look, this is cowardly stuff to do this, and I just urge anyone who has any information about it to provide the information to Crime Stoppers.
Was it linked to mandatory vaccination?
Yes. Yes.
Can I ask you
Any
one
of the
thing?
new cases today, are they in at Juniper or any aged care facilities? Are there any new aged care cases today?
I'm only aware of 2 at this point. I expect there'll be more, but I'm only aware of 2.
And just on the new local cases today, are they still contained to Perth, Bunbury, Wheatbelt, or have any other regional parts of the state been recording cases?
I haven't been advised of anywhere else across Western Australia that has recorded cases at this point in time.
Just on Banksia Hill, if I could ask you, Judge Hilton Quayle has effectively said that it's safer to release a troubled 15-year-old into the community than back to Banksia Hill in 79 and 97 days in solitary confinement. He said, when you treat a damaged child like an animal, they will behave like one. If you want to make a monster, this is how you do it. What does that say about the conditions at Banksia Hill?
Look, there's no easy solutions with this. Children's prisons, obviously, not a pleasant subject matter. And the issues behind these sorts of things are complex. The courts obviously have a role in rehabilitation, as does the state, but also protection of the public. So that's why there's a lot of things that go into these matters. Imprisoning children is always a last resort, but it's only ever used in the most extraordinary or serious of cases. But there's no easy solutions with this.
They're pretty damning comments, though, aren't they?
They are, but there's no, a lot of people are in prison for pretty serious crimes, and so you've got to protect the public and put in place efforts to rehabilitate. So Banksia Hill actually has a whole range of rehabilitation programs for children that are there to try and get kids back on the right track as well. But look, there's no easy answers here. There's actually Banksia Hill is not full. It's used as the last resort for the most serious of offences.
Sorry.
I know you've been asked about WA professors modelling in the past, and you've said he's a mathematician. That is his area of expertise. Do you stand by that comment?
Look, I'll just make the point to you all. On February 5, we had relatively low levels of third dose vaccination. Had we deliberately introduced hundreds or thousands of new cases into the community, lots of people would have died, lots of people would have lost their jobs, and the economy would have suffered enormously. So we didn't want to do that. We obviously have an obligation to the people of the state to save lives. I mean, that's actually my highest obligation, save the people of the state's lives. And that's what our measures are doing. We're getting our third dose vaccination rate up each and every day. We're putting in place all sorts of measures to manage the spread of the virus that's in place in Western Australia at the moment. But just going from 0 to thousands overnight would have cost numerous lives whilst our third dose vaccination rate is low, and that's why we didn't want to do it.
In terms of your own modelling, do you agree with your health minister that there's no need to release the modelling because young people don't care?
I really doubt she said that. But in any event, there's no reliable modelling at this point in time. So Omicron has only been around since late November, so modelling it was very difficult. But I just make the point. There's a lot of factors that go into modelling, but one of the factors that you all need to understand is opening overnight from no cases to thousands would have been a catastrophe, and there was no way that I was going to sort of make a catastrophe fall upon the people of Western Australia whilst we had low third dose rates.
Opening the border or not, she did say yesterday that young people didn't care and it likely wouldn't raise testing numbers in that cohort if modelling was released. But what is the harm in releasing preliminary modelling if you tell people it's preliminary?
Look, when we get reliable modelling, we'll release it. So that's no doubt at some point in the future.
Who is doing that modelling?
I understand the Department of Health is working on all these things as we speak.
Are they, is it an epidemiologist?
Well, the Department of Health has all of those people, health epidemiologists, public health experts, all those sorts of people. So we're reviewing all of the matters at the moment so that we can reach the optimum outcome for Western Australia.
But what is the harm in releasing it? Because it is forming some health advice that's in place now.
No, we don't release incomplete and information that isn't useful.
The 102 travel-related positive cases, they were all triple vaccinated and obviously had to have a negative test before they came in. Are you surprised that these numbers, there is such a large number of travel-related positive cases so quickly?
Well, I'll tell you what, had we not had any quarantine and testing requirements, it would have been a lot more. And if we'd opened the border and let thousands of people in without the requirement to quarantine and test, it would have been thousands of cases out there in the community spreading it everywhere. So we've avoided that catastrophe. But look, people are required to get a test before they come over. Obviously, some people develop the virus after they get a test, and I think that's probably what's occurred here.
Do you accept, though, sure, do you accept, though, that there's some validity to the observation that the longer you delay letting the disease in, it's going to clash when you've got, the longer you delay, it's going to clash with the flu season, and then we're in a different circumstance altogether.
Yeah, all those things are part of our considerations. So obviously, as part of the review, that's taken into account, as indeed the rate of climb in vaccination rate, the rate of decline in cases over east. All those things are taken into account in terms of what we do. So that will all be part of the review that's being conducted as we speak.
But then that's to accept that the cases will get worse as we get closer to flu season, so it's counterproductive to just let it go.
Yeah, as I've said to you a number of times here, the advice from the Chief Medical Officer of Australia is they expect another wave over those months. So it's not like you have it come once and it's over. They're expecting more waves. So the idea that I think some people have is that it'll just come in, we get through it, and then it's done. That's not what they're telling us. They're telling us there will be further waves throughout the course of this year. So waiting till we get higher vaccination levels, before we have broader community spread, is actually a good thing.
WA's booster rate is 48%.
Yeah.
Is your understanding that the booster rate in WA's aged care homes is below 48%?
The third dose, I couldn't tell you exactly, but I know that the first and second dose are below where we're at currently. But it's a big issue, and we're happy to help the Commonwealth, but I just want everyone to understand, we make the offers all the time, and we'd like to help with these things, but they really need to make this a priority, because aged care has been shown in the east, particularly in Victoria, to be a very, very vulnerable cohort. Thank you.
Thank you.
Thank you.